Greetings once again. It's a pleasure to be back, and it's a pleasure to be continuing these conversations that we normally have. So today I'm going to talk about digital health solutions and their place in pharmacy practice. And the reason as to why I'm talking about this is because we all know every other facet of our life is influenced and actually integrates the use of technology in one way or the other. So the question is, what does it play in terms of the healthcare space? That's one. And two, beyond just the general healthcare space, in the pharmacy space, what does digital health solutions have to offer? And how can we make the best of them in terms of our pharmacy practice? And I take part in some of the stakeholder-related engagements and conversations. And I've noted that this is a growing area, but as pharmacists, we've not taken a keen interest, or rather, if we've taken an interest, is in some piecemeal perspectives. And for me, in making this video, the focus was to look at it in terms of what is the holistic place in terms of integrating digital health solutions and technological solutions and platforms into our own pharmacy practice, and looking at it from the farthest end where we start from generating new products, new molecules, to the ultimate end where it's being used by the patient. And therefore, with that in face, then we have a clear picture on what can we use, where can we use digital health solutions, what are they in the first place, how do we integrate them in our lives, how do we integrate them in practice, and how do we use it to improve quality of healthcare outcomes for the patients that we serve, for the individuals that we serve through our practice and their areas of work. So when we look at that dynamic space where we're talking about pharmacy practice, the first thing that I start with is, what's digital health? And therefore, when we talk about digital and we say technology is a part of the digital solutions that we have, therefore it means the use of information, communication, and technological solutions, or devices, gadgets, whatever it is that has a technological component to it in the healthcare space, with a focus on improving health outcomes, promoting wellness, and delivering medical care or medical interventions. So when you go to a hospital, let's say, for example, you start with measuring your blood pressure, a sphygmomanometer being used. That is a digital technological solution. Your blood sugar has to be taken. Somebody is using a glucometer at the glucose strips. Those are technological solutions. They're not there initially. So how are you using them better? You take your temperature, thermometer is going to be used. That's a digital solution by itself. But then now we move to the interface now where we're talking about smart devices, smart gadgets. You have a smartwatch that will be taking your blood pressure, your temperature, your pulse rate, and documenting this for you to be monitoring whether you are working optimally in terms of your exercising. If you're doing your exercises, you have the proper heartbeat rate in terms of cardiovascular risk and all that that's happening. So the use of digital health solution technologies, that is information communication and technological solutions, to help you improve on your wellness, to help you take care of your medical condition, to monitor how you're performing. That is what we consider as digital health. So when we look at it within the pharmacy space, all these digital technologies can be used, and they can be used in different facets. And on my right, if you can see the screen, the digital health will have from clinical trials, there's a role that they play. M-Health, mobile health solutions, using your mobile phone to do certain things in terms of things for your health, even including the M-Tiba wallets that are being used and such kind of things, mobile phones. Using mobile phone to read about information, using mobile technologies, mobile platforms to communicate, the chatbots that are coming, those are mobile health solutions. In terms of your wellness, how do you buy your medicine? Probably you buy through an online platform, the wellness products. Telehealthcare and remote monitoring, you're talking to your physician on phone, you're talking to somebody who is guiding you and counseling you on mobile phone or video conferencing. All these are remote teleconference facilities. Visualization, monitoring, and actually visualizing the progress and movement of your products, financial trends, the dynamics of the market, all that. The wearables I mentioned, the smartwatches that you're talking about, taking your vitals and measuring them. Health analytics, analyzing the health data that is being recorded. For example, when you're now dealing with COVID-19, can we analyze the trends in terms of the peak and the off-peak seasons? What are the factors that are associated with such kind of trends? So that is all that use of technologies to ensure that we know about health determinants, health variables, and using that information to make informed decisions on how do we treat people, how do we intervene to prevent diseases, and how do we help them stay healthy long-term. So in the pharmacy space, when I talk about digital technologies, I see the aspect where we start with upstream. And we talk of upstream is at the initial moment when you're dealing with pharmacy medicines. There's never a place that you'll talk about pharmacy that you'll not entail talking about medicines. So when you start about upstream aspect in terms of the initial phase of getting to know of a medicine, designing a medicine, we have the research and development component. That is where there's so much technology. When you hear about people talking about precision medicine, the platform-based therapies, gene therapies, all these, they're technological modeling and design thinking solutions that have been designed to help us identify how molecules will react to integrate into your receptors, your body receptors, how they need to work there, whether they're going to give us the response that we hope for, targeted therapies. All that is involving technology. So we're using technological solutions to research and develop new medicines. Understanding your receptors as a human being and the body, how they work, understanding the molecule, the product that we are going to use, either it's a small molecule or a biological product, how they're going to blend. And once that binding takes place, what is the reaction? What is the response that is going to be elicited? Is it going to facilitate a cascade of reaction? Let's say, for example, protein synthesis that is going to lead to change in terms of particular thing that is being produced or not? Is it going to cause the killing of that that bacteria that is affecting you? Is it going to prevent the replication of the virus so that you get better? So how does that work? Understanding the upstream component, that is where technological solutions are coming. And in research and development, you could talk about in silico screening of molecules and design thinking on designing them. That is from the in silico screening. We have other molecules and other parameter, computational designs. All those are in place, precision medicine. Then after research and development, the product has been developed. Now we have to take it to clinical trials. We need to share data with patients. We need to share data with the clinical doctors and the medics that are helping us in doing the clinical trials. Even the pharmacists who are the clinical research scientists, clinical research pharmacists, they need technologies to share information with the pharmaceutical developer who are in the company, who are doing the design, from them at the pharmacy level, at the community pharmacy or the hospital pharmacy level, at the clinical research centers, so that data sharing takes place. That is research. That is also part of the use of digital technologies. Then once the product has been passed through the clinical trial phase, now we have a product that can be used in the market. It has to be registered in each and every country where it's going to be used. So data sharing, what data sharing tools do we have in terms of use of digital technologies? Can we have a common platform that we use with the regulatory authorities so that we share our information there, they review, share feedback on the same platform, and that is working with most of the health authorities. So the data sharing component and documentation, the clinical trial data that I mentioned, that has to be shared on the same platform. Then now once that is done, we go to the next phase where reporting of any adverse events, that's also with health authorities, with the pharmaceutical companies, the patients and the healthcare providers, so that that information keeps coming. Then once that initial phase is done, products need to get to the patients. That is the supply chain. Pharmaceutical supply chain, we talk about forecasting. We need to talk about planning. We need about quantification and planning. Then we need the procurement sourcing. Once we source them, we need to distribute them to the end patient who need them. We need technologies to be able to monitor where did they start from, where they're getting to, so that we ensure any unwanted product don't get into the chain. That is fast in terms of traceability, tracking the product. So that is the whole spectrum on supply chain management. We need that information to flow, and we need to be able to track the medicine as it goes. The other products that need temperature control, I talked about the thermometer. You need to have temperature controls and monitoring to ensure when your product is moving across the chain, it gets to the end patient in the right temperature without having been interfered with in terms of any changes that happened. So all that is involving technologies. It gets to the end consumer, it needs to be used, then that would be okay. At the upstream level, we've talked about it from research and development up to the end where it gets to being supplied. Then downstream, I'll start downstream from a distributor or wholesaler perspective, where they now use that product and actually get it to the pharmacy retailer level or a hospital level. The pharmacists can use digital technologies beyond that now. One, you need to talk to your patients. You have the mHealth and teleconferencing, telehealth, telepharmacy. Can you talk to your pharmacist on phone? Can you chat on a mobile device and share information with them that they need? They share the prescription, you fill it for them and actually document that it had been refilled so that there's nobody accessing it. That's patient care. Just monitoring patient vitals at the level of where you're taking care of them. You're taking the blood sugar, taking your blood pressure, and then monitoring the oxygen level, oxygen saturation. All these, that is the patient care level. Health advocacy, all the advocacy organizations that are working. Pharmacists, we need to take an active role and actually venture into this space as well. As we get into health advocacy, social media gives us a platform, and these are technological solutions. We take advantage of them, talk about issues, communicate. When we communicate, we share information, we amplify our voices and create awareness about what needs to be done, how it needs to be done, and we are shaping policies. And that is where we need also to really see how we're using technologies. Communication and data interchange at the patient downstream level, we're talking about even the financing information. Who is paying for what product? That will also be integrated into supply chain management as well. Who is paying for it? How much are they paying for it? How feasible is it? We'll get out with the analytics to know what is the potential of the market, how much need is there, using that information to inform government in terms of policy and budgeting and planning work, and also informing the end consumers to know which services they need and helping the patients and the healthcare doctors, the pharmacists, to stock what is needed. Because imagine you're running a pharmacy in a region where most people suffer from malaria, and all the medicines you have are for diabetes. You're not going to meet their needs, and you're also going to have dead stock that is never going to be sold. So that communication and data interchange, it's about having visibility and having the information that is critical to help you make the right decision when you know where you need to make it. That is good for us. Supply chain management, I'm talking about e-commerce platforms. We have e-pharmacies that have their products populated on an online interface. Patients buy from that interface, they upload their prescriptions, and these kind of things that are happening, they're giving us to see, by the way, technology has a critical role that it plays in our lives, and they need to make it be a critical bit of what we do, how we do it, and ensure that it is working for us, not working against us. And those are all advances in terms of solution. And the other bit that I'm actually, when I talk about digital health solution in pharmacy practice, I see it as a revolutionizing capability and platform for us that is available. We can use it to document the level of work we do. Because most of our place is not being monitored, and actually we're not tracking much of what we do. And if we're not tracking it, we're losing as a practice, we're losing as a profession. But the only way to do that is by using these digital technologies to be able to monitor and actually see, by the way, over this period of time, let's say, for example, when you talk about sexual reproductive health products, sanitary towels, how many did I sell over this period? How many did I even distribute if it's, let's say, they're being distributed through the government, but by pharmacists? Then it means we can even say, by the way, over this period of time, we were able to monitor and actually provide this number of sanitary towels. Mental health services, I was able to cancel this number of patients because you're doing telecounseling, psychotherapeutic support groups. And these digital technologies are helping you document, monitor, and report accordingly. One of the key bits that I didn't talk about is the health information management system. Managing healthcare solutions, healthcare challenge problems generally has been a problem because we don't have data. And when we don't have data, we don't know what we're dealing with. But now, because of technology, we're having access to so much data that we need to be strategic on what is the use of that data. How are we going to collect it? How are we going to process it? And that is technology that's going to help us do it. So as data scientists, data specialists, are we able to think through it? Are we able to design solutions? Are we able to use technologies? Can we talk to our patients on WhatsApp groups? Can we communicate with them? Imagine I see certain conversations where you find the community health workers have WhatsApp group that they're engaging the patients, but you as a pharmacist working in the very community, you've never had a WhatsApp group to engage with your community people. How are you serving them then? Are you taking your value to them, or are you waiting for them to come to you? And if you wait for them to come to you, definitely somebody is going to them that might never come to you. And if they don't, you're losing out as a pharmacist, as you're losing out as a strategic position play in the healthcare industry. And I believe digital technologies have a lot to offer to us. They have a lot of potential. And in terms of even design, we need to design them with the people who are going to work with them and are going to help us deliver solutions that we need. And that is where I think there's so much potential in the business development of digital technologies, so much potential in the use of digital technologies in terms of delivering our services, integrating it in every facet of our lives, and knowing what is the ultimate outcome of our work. And I believe if we do that and we integrate digital solutions as part of who we are and what we do, then we'll be in a better position as pharmacists and will not be taken aback by the dynamics of the industry as they come around. That is all I can encourage you to do. And as we end this, I encourage you to subscribe to the channel. Let's engage, let's learn. Share with me the topic that you'd want me to talk about as we continue the conversations. Hopefully we'll improve on pharmacy practice and bring pharmacy to where it needs to be. I believe pharmacy will be in a better position to help address the health challenges we have as a society. And the only way to do that is by creating knowledge and creating awareness on what potential lies within us and lies within the industry to drive this change. Thank you so much. Let's meet again next Sunday.